Hello, everyone, and welcome to the first of a two-part series, Engaging Prevention in a Virtual Environment. Again, this is session 1. Our presenters today are Erin, Ficker and Kris Gabrielsen. Today's webinar is brought to you by the Great Lakes ATTC, Great Lakes PTTC, Great Lakes MHTTC, and SAMHSA. A little bit about us. The Great Lakes ATTC, MHTTC, and PTTC are all funded through SAMHSA. This presentation was prepared for the Great Lakes ATTC, MHTTC, and PTTC under a cooperative agreement from SAMHSA. And the opinions expressed in this webinar are those of the speaker and do not reflect the official position of DHHS or SAMHSA. These are the cooperative agreements we are funded under. And just a few quick housekeeping details. Today's webinar will be recorded and will be available on the Great Lakes Current YouTube channel and the Great Lakes PTTC products page. There will be attendance certificates issued for this webinar. They will be emailed to you and it may take up to 2 weeks. Please send any other general questions you have regarding online resources or recorded webinars to the Great Lakes PTTC. And now I'm going to turn it over to Erin.
Hi, and good morning. My name is Erin Ficker. I am one of 2 of the prevention managers at the Great Lakes PTTC, and I'm really excited to be here with you today. And I thank you for choosing to spend a little bit of your time with us. Our webinar today, Moving Prevention into the Virtual Environment, is timely and important because of the world that we are currently living in. We chose to do this and put together this webinar so that we could talk about the importance for prevention in this time. It has become more important than ever, and in some ways more difficult than ever, and we need to be more creative than we've ever had to be. So we are here to talk about ways that we can think about moving our prevention efforts into this virtual environment in this time where we can't be physically together and do the prevention efforts in the way that we have traditionally done them. So as we are in this environment and we're here, you'll see you have some features. We would like you to use the chat to ask general questions, or if you need things specific to your technology, you can ask those questions there. We also would ask that you use the Q&A. So in addition to the chat, we have a specific Q&A. So if you can click on that, you'll see it provides a place for you to ask specific questions. If you ask a question there, we'll make sure that you can use it. Once a question is asked, can we have someone ask let's see if there's a question in the Q&A.
I'll type one in fast.
Okay, thanks.
Oh, there we go. No,
so there we go.
Cheryl wrote something.
Thanks,
Thank you,
Kris.
Cheryl.
Thank you, Cheryl. So as you can see, Cheryl has written a question in, and I can like that. You can click on the like. And if you have a question, you have the same question, you agree with that question, you'd like to hear us answer that question, you can click the like, and the more likes we get, the more we know that everyone has that question. So because we have a large audience today, it is very helpful for us if you can click on that so we can see, boy, a lot of people want us to answer that question. So we'll make sure we get to those. We will take pauses throughout the webinar to answer questions. So please use that. So I can see your question. This is wonderful. Thank you so much. So we will be doing that throughout. Excuse me. So please use that if you have any questions throughout. Otherwise, you can use the chat. So I see someone saying they're having a hard time seeing that. If you go to the bottom of your screen and mouse over kind of the black area at the bottom, there should be, excuse me, a box that says Q&A. And that's where you can click and type in your questions there. Okay, so we appreciate you using that specific part of the technology. It's very helpful for us and hopefully helpful for you guys to see. Great. So I want to introduce to you our primary presenter today, Kris Gabrielsen, and I could not be more delighted that Kris has agreed to be here with us today. Kris has worked in the substance abuse prevention field for a very long time, since the early 90s, and we are just—
Hey, stop aging me.
Sorry. I like to age her a little bit. It makes me feel good. She's worked at all levels of prevention. She's an author of textbooks on the topic, dozens and dozens and dozens, probably hundreds of trainings and workshops and topics. She's coordinated grant writing teams. She's worked at the federal, state, community level, and has worked just across the country in different areas to help enhance the effectiveness of prevention. So she also has a lot of experience in this field of how you can translate your prevention, how you can do really good planning. So we're really lucky to have her with us today. She is going to talk about how we can be planful and thoughtful about moving our prevention efforts into the virtual environment. So I'm going to stop talking because I'm not the one you came to listen to today, and I'm going to turn it over to Kris and let her introduce our day for you.
All right, thanks, Erin. Well, welcome everybody. So glad you're here. Fantastic to be on here with you all. I always prefer when we can to have it be in the Zoom meeting versus Zoom webinar so I could see you all also, but there was a lot of interest in that, so the technology wasn't going to work that way. So I hopefully will see you through a Zoom meeting some other time to actually see you instead of you just seeing me. So I do hope you all are doing well so far today. I'm going to share my screen with you to show you where we are going over the next almost hour and a half or so. So first we're going to do a quick chat box of what your expectations are for the next hour and a half. And just to make sure that you understand that this is the first of 2 webinars. So today we will not be getting into the actual technology pieces or how to facilitate virtually. Those are going to be happening next week. So if you want to hear about that, be sure to join in then. But today we are going to talk about which virtual platforms are useful for each communication need. So as we're looking at translating our prevention strategies to virtual settings, and then we're also going to look at virtual platforms and the considerations that we will want to take into consideration as we're converting different strategies from in-person to virtually by CSAP strategies. So taking a broader look in terms of the type of communication and then a little bit more specifically by each CSAP strategy. And last, but perhaps the most important, are some tools that we want to present to you that will help you actually walk through each of the steps of thinking through taking this strategy that's in person and moving it over to a virtual setting. So that is the plan for today. If you could go ahead in your chat box, if you could indicate what you're expecting or hoping to get out of the next hour and a half, hour and 20 minutes with our time together, realizing that these are the kinds of things that we're going to cover. What are you hoping by the end of the time you're going to get out of it? If you could go ahead and use your chat box, not the Q&A, but the chat box for this, please. So engaging ways to get people to talk on web calls. We're going to talk about that next week. We actually have a specific engagement piece next week, just to let you know. And these are going fast because we got so many people, but we'll kind of glance as it goes through. New ideas on how to reach prevention goals through technology. Absolutely, we're going to do that. Let's see. Oh, you guys, I love all these ideas and thoughts about what you want to do. Thank you. Variety of virtual platforms. Absolutely. All right. Innovative ways to implement strategies. All right, Erin, go ahead.
They're going to fast. How to teach botvins, how to reach students, This is great. I saw someone saying how to move your YPE or your youth prevention ed online, how to use mindfully connect with coworkers, how to move prevention work to an online platform. You guys, these are really great. You're definitely thinking about how to move online. Tangible information to use for organizations as they transition. We're going to do that.
All right. Sounds like we're pretty well on track. So just realize, again, that this is the first part of 2, so we won't cover everything today, but we're going to lay out the basic steps that you will need to take as you're thinking about your individual prevention strategies, moving them virtually, whether or not that's going to work. So with, I'm seeing specifically Botman's life skills or those kind of things. We aren't going to get down to the individual strategies because you all are implementing so many. There's no way we could do that. So we're going to give you a process to think through your individual strategies. So I'm hoping that will do the trick for you. That's what the goal is.
Mm-hmm.
All right. Anything else, Erin, that you saw pop out that you wanted to mention?
No, how to evaluate services online. I don't think we're going to get quite down to that detail, but again, we're going to give you planning tools that are going to help you think through that exact issue. I saw how to meet standards. We're going to talk about that. A lot of the tools we're going to give you are really going to help you think this through. So again, I think we're going to get to the broad topics and then the planning specific for you. These are great, you guys.
All right. Thank you, everybody. Appreciate your adding that in. All right. So we are going to move into now looking at communication. And I'm going to go ahead and stop sharing at the moment. My screen, there we go. So as we are looking at our prevention strategies, all the kinds of things that we do as a prevention field, the different strategies use different types of communication methods. So for example, there's one way, we're going to talk about 4. We're going to talk about one-way communication, two-way communication, cross-team communication strategies, as well as one-on-one. So in general, when we're thinking about all the things that we do in our substance misuse prevention world, they typically fall within those 4 categories. So I'm going to go through one by one through these different types of communication and look at what kind of virtual platforms could be useful for each of those types. So let's go ahead and do the first one. I'm going to switch back over. And one-way communication. So let's take a look at that first. So possible platforms, and I should mention also right now that you either have in your email inbox or you will get soon after this. I need to verify that. Maybe one of those folks on here can let me know. A resource guide that has information about the different types of platforms, virtual platforms outlined, as well as different collaborative software, which we're going to talk about here. So if you're needing more of those details of what these different things look like, those are in your resource guide. All right, and I have a feeling I see some chat going. Did somebody answer that question?
Yep, they have received those.
Guide?
Mm-hmm. Or they
Great.
will send, and we will also send it again.
We'll send it. Yeah, we definitely will. And I should say that we should probably preempt that. We will be sending out copies of the recording, as well as any of the handouts that we talk about during this session, or the references of resources. We will send those out to you after the session. So just want to make sure you know you're covered with that. All right, so when we're thinking about one-way communication, so it's just going from me to somebody else, you know, from me to my community, from our prevention program to all the schools, one-way direction kind of communication. Some possible virtual platforms include mass media. So some of these are things we've already been using, right? So things like TV, radio, newspapers, you know, lots of newspapers are now virtual, online only, and they're more and more turning that way. And then there's also social media. It can be a great one-way tool in terms of Facebook, Instagram. You know, we can move into some of the ones the younger folks are using. You know, TikTok, Snapchat is often one way, but there could be some two-way communication going on with that too. Webinars like we're doing right now is an example of one-way communication, as well as, of course, websites. So some of the stuff that with one-way communication we've already been doing. I would love to hear from you right now. If you could, in the chat box again, if you could move to the chat box, share, let me turn my notes here. What is an example of a component of a prevention strategy that you have implemented that uses one-way communication? So if in your chat box, go ahead and put what's an example of a component. So it doesn't, a prevention program can have lots of different pieces to it. What's a component of your prevention strategy that uses one-way communication? I see some folks are starting to type. Let me pull up my chat box. Erin, you're muted.
I was so good. Social media, Facebook. I see people saying posters, newsletters, lots of newsletters, social media, press releases, YouTube announcements, communication campaigns, brochures, so many newsletters.
Lots of
I love the newsletters.
Great, but I love that somebody mentioned YouTube. That is not one that I mentioned, but that's absolutely a one-way communication tool that can be very useful. And the number of people using YouTube right now or watching YouTube videos is huge. I was just looking at a stat. It's like every day, like 46% of Americans are watching a YouTube video or something like that. It was a large number of folks. They're like, really? That many people on YouTube? So absolutely, that is a good tool to use. All right.
Oh, podcasts?
Thank
I
you,
think
everybody.
I saw a couple people saying podcasts. Great.
Absolutely love it. I love it. Yes. All right. Well, let's think about two-way communication. Switch over a little bit. We're going to switch to two-way communication. So some ways we can do this virtually. We can do more the old-fashioned conference calls, as well as virtual workshops such as this, where it's the Zoom meeting where you can actually see other people and you can talk back and forth. That would be considered a two-way communication platform. Of course, there's one-on-one phone calls is a good old-fashioned communication tool for two-way communication. Online discussion groups can be very useful in this kind of communication. Communities of practice, where you set up some structure in terms of a group of folks coming together to learn from one another, as well as, for some reason, I have online discussion groups twice. I guess I felt really strongly about that. Sorry about that. So again, some examples of ways that we can accomplish two-way communication virtually. Love for you to pull up your chat box again right now and share what are some things that you have done with prevention, with your prevention strategies, with two-way communication in a virtual manner. So if you could go ahead in the chat box, give us some more examples.
Microsoft Teams, Zoom, coalition meetings on Zoom, awesome. Google Meets,
Great.
movie nights, SurveyMonkey, coalition meetings, Google Meets with students, advisory youth committee on Zoom, coalition Zoom meetings, Google Forms. Blue Jeans?
Google Forms would be more of a one-way communication, or forums. Was it forums or forms?
I think it said forms, but that could be asynchronous two-way.
I think
maybe
I would call Google Forms more of a one-way. There's of course Google Chat, Google Meet,
Google Classroom.
Yeah, so there's those that it can be more of a two-way.
Slack, Skype. What is Blue Jeans? Someone said Blue Jeans.
Oh,
Hangouts.
I'm not familiar with that.
I don't know, me neither.
All right. All these are fantastic.
Lots of stuff. Yeah.
FaceTime, absolutely. Great. All right. So let's switch gears a little bit and talk about cross-team communication. So a lot of you mentioned coalition meetings on Zoom, it sounds like, which is fantastic that you've been able to do that and move in that direction. So when we're talking about cross-team communication, such as coalitions, some possible platforms are collaboration software, which again, in your resource guide, there's a list of many different kinds of collaborative software. Those are tools designed specifically for teams to work together on projects. So to be able to talk about tasks and be able to different categories of working on this plan. These are the things that are happening, and people go in and work on things together. So that's the collaboration software or collaborative software. Virtual platforms, of course, like we were just talking about with things like Zoom and Skype and WebEx, Ring Central, all these different kinds of platforms where we could do video conferencing or talking with each other in those different ways. And of course, the good old-fashioned phone calls. Sometimes we forget that we can just go basic and it still works. So we can do conference calls or just phone calls for that cross-team communication. All right, so as you're thinking about those teams of folks that you're working with, so perhaps if you're in the school system, there's a group of folks within your school system, or if it's a community, it might or if you're a prevention professional, perhaps at the county level, maybe you connect with the other county prevention professionals. So whatever groups of folks that you tend to work with on projects, what are some tools that you have continued to use over the last couple of months as virtual tools? If you go ahead and chat again, give us some examples would be great. And Erin, if you can list off a few of those, it's not wanting me to see my chat as I'm on this screen.
Basecamp, Excel, Zoom, GoToMeeting, Coalition Facebook page, educational videos, Doodle polls, youth coalition meetings, Microsoft Teams has helped us work better. Zoom team, phone calls, FaceTime on phones, Excel, Zoom, GoToMeetings, Slack, Google Drive, a lot of the same things we're seeing using in different ways for different things. Where's the resource guide you mentioned? Should have been emailed to you, will be emailed again at the end. Google Forms for pre and post tests, online meetings, GoToMeetings, texting and email.
All right.
Dropbox, OneDrive, of course.
Great. Sounds like people are using.
Of course, all that with lots of coffee.
What was that, Erin?
Someone said, oh, of course, all of this with lots of coffee.
Oh, yes, of course.
So much. Look, we've learned so much. So much.
Isn't it? And I just love that every day I'm continuing to learn more about this. So
someone said,
go ahead, Erin.
Someone says Monday.com, which is something I've not heard of, is another.
Mundane, like
Monday. Monday, like the day of the week. Monday.com.
Okay. Not familiar with that either. I'll have to check that out. All right. So with, again, many options exist out there to do this. And what we're needing to figure out as we're going back and looking at our prevention strategies is what kind of communication we need to accomplish that strategy. So that's why we're going through one by one with these types of strategies and the types of tools that exist out there to accomplish that. So let's move on to this last one. In terms of the types of communication is one-on-one, of course. So one-on-one is sometimes needs some more specific kind of platform, although things like we've talked about with Zoom, you can use it one-on-one. Skype, you can of course use it one-on-one. All these different things, you can take what could be used for a very large group and you could go down to one-on-one. So don't discount any of those. But then you also, of course, good old phone calls. Just want to remind y'all, that's okay. And it's sometimes preferred by folks. So, I was on a Zoom session with one person yesterday doing some planning work, and I popped on the call, and he had his camera pointed out the window. He said, I don't think people want to see me anymore today. So, sometimes I think more he just didn't want to be on camera anymore, that day, which is completely understandable. So I think sometimes we need to think about what is going to be the preferred type of communication by the other participant as well as you. I mean, we all know we are on many, many Zoom type sessions a day right now. So the last one on here is telehealth platforms. Some of you all might work in agencies where there's telehealth going on already. And so that'd be something to explore if that is an option for you to be able to access those platforms. All right, last chat for the types of communication strategies. Love to hear what you're using for one-on-one type communication for your prevention strategies right now. If you can go ahead and put that in the chat box, that would be great. And I'm going to go ahead and stop sharing my screen. All right, Erin, what are you seeing there?
It's coming fast. Zoom, emails, calls, Skype, Zoom healthcare, Teams, lots of Teams, emails, Zoom without camera if people tired, so tired of seeing my own face. DoxyMe, which is a medical one that I've seen a lot, emails, conference calls, Zoom, GoToMeetings,
All right.
Yeah, lots of the same things being used in different ways. Lots of our traditional communication systems like they're being used. MS Teams, FaceTime, PingMed, which I'm not familiar with.
Looks like a few folks are using that.
Yeah.
Or I guess Kevin might have said it twice. Thanks, Kevin. I'm not familiar with that. I'm guessing that's a telehealth platform. Is that right? And of course, texting. Yes, Natty just posted texting, which can be, depending on your audience,
right?
It can be, there are times that I have 14 and 17-year-old boys, and there are times that if I really want to communicate with them, we might be in different parts of the house. I'll go ahead and I'll just text them and they respond. So yes, thinking about your audience is great.
So yeah, I mean, sometimes it's just so much easier thinking about when people are available. That's great.
Absolutely. All right, thank you, everybody. Oh, and Kevin responded, PingMD is part of there's more acronyms that I don't know. KIPUMER. Sorry, I'm not familiar with that. It's part of do you know that, Erin, what KIPUMER is? Yeah. Oh, here we go. Oh, and Christina says, so not everybody can see the chat. Okay, this is good to know, Christina. So Christina says, if you want to share your answers in chat to everyone, please change your recipients from in the to button where you can click for the down arrow, click it to all everyone instead of to all panelists, because it might be that we're just seeing this, which I want everybody, if you're comfortable, to see your responses. So please do that. Thanks, Christina. All right. So let's go ahead, now that we talked about the 4 types of communication and possible virtual strategies for each, let's turn to the Q&A box. And Erin, is there anything that you are wanting us to answer at this point? Do you think would be helpful to answer at this point?
Not at this point. No.
Because it might be covered a little bit later, because we're also looking to see whether or not we're going to cover it later. Then we might hold on to your question and make sure we answer it a little bit later.
Yep, I think we're going to hold on.
Okay, great. Okay, and for folks who want to know, Kevin did reply with the explanation. Electronic medical records, KIPU is an EMR vendor. Okay, great. Thank you, Kevin. All right, a poll for you all. Christina, are you ready? Let's go ahead and pull up this poll. I want to know how we're doing so far. We have a very large group, so it would be great for me to get a sense of how things are going so far, especially because I can't see your faces, so I have no idea how you're looking. If you're like, I have no idea what Kris is talking about, or yeah, I'm right there with you, Kris. So, or maybe somewhere in between. Go ahead and answer. All right, we'll give just a couple more seconds here. And all right, Christina, can you go ahead and share the results? And Janice asked what the program we use, and this is just within Zoom. It has the polling within Zoom. All right. Okay. Looks like people are following along right there with me. Either they're mostly following along or they're right there with us. So, and somewhat understanding the content, please feel free to share. If you're getting lost, go to the Q&A and ask some questions. Also, this is recorded, so if you need to go back and watch it again, feel free to do that. I know I have to do that at times to really understand, especially if it's new information to me. Takes a few times to get through. So, all right. So, and I'll just ask, Julie asked, can you share how large of a group we are? I look at, there's 252 participants right now on my screen. So, great size group. I'm glad that you're all on here. And I wish I could see their photos of you because I love seeing that part. But trust me that I'm really glad that you're here. All right. And the recordings will be sent to you by email. So you will get that, the recording of the session. All right, let's move along then. As I talked about, we went from kind of broader communication, what we're looking at for communication in the different types of prevention strategies we do. So let's get more specific by CSAP strategy. So many of you look at CSAP strategies as a way to categorize what you're doing and to see if you're covering like a broad spectrum of the types of prevention strategies we can do. So let's go ahead and go one by one through the CSAP strategies. And for those of you new to this terminology, I'm going to quickly go through a definition and examples of them before we move to the type of communication strategies to platforms that we're going to want to use. All right, so let's start with, I'm going to switch over from that one to information dissemination. So with information dissemination, this category of prevention strategies is focused on providing knowledge and awareness through one-way communication. So there's a cue for you in terms of going back to the last set of slides. So it's typically through one-way communication about drug use, misuse, abuse, the effects of substance misuse, and prevention resources and services available. So things that fall into this category are things like clearinghouses, information resource centers, media campaigns, radio and television ads, speaking engagements, health fairs, those kinds of things. So it's getting information about resources, information, facts, those kinds of things. All right. So when we're looking at how we can translate these strategies, these kind of activities going on, prevention activities going on, we're looking mostly, I have the picture of a one-way, right? Tied back to the last one. Really, it's the same kind of things that we had listed in the last set of slides for one-way communication. Mass media, social media, webinars, and websites. So this is an easy one in terms of CSAP strategies. Yeah, it just pretty much translates straight from the one-way communication strategies to this one. With the prevention education strategies, we're looking at two-way communication between facilitator and participants. And the goal of education strategies in general are to affect critical life and social skills. So we're getting some of those underlying skills that folks need to make some good choices around their behavior around substance misuse. All right, some examples you'll see on the right-hand side are classrooms or small group sessions, parenting and family management classes, peer leader type programs, peer helpers, education programs for youth groups, and more of a real specific example is children of substance abusers groups. So those are, they can get from broad kind of population kind of groups to some real specific focused populations. So when we're thinking about education, just like with information dissemination, where it was pretty clear direct correlation to the one-way communication, with education, it's pretty direct correlation to the two-way communication. So same kinds of things that you saw on that slide from before, and what we talked about are workshops using virtual platforms. So again, we're talking about two-way communication this time. So Something like what we're doing right now is one-way communication. So if you were looking at wanting to do two-way communication for an education kind of strategy, you would want it to be a smaller group. So you could use something like Zoom meeting, or you can use the different platforms, but you want something smaller so you can actually have the two-way interaction. We try to do it through like polls and chats and different things, but that helps, but we aren't quite there. I wouldn't call this exactly two-way communication. Kind of, but not quite. We wouldn't accomplish the same goals if we had a smaller group. So some other things, of course, conference calls via the phone, some one-on-one calls can be a two-way education type opportunity, two-way communication opportunity. Online discussion groups that can be created. So for example, if you were holding a parenting education class and you wanted to keep communication with those parents, you can use some of the different platforms that are designed specifically for online discussion groups and create an opportunity for those parents to continue to connect in that way. And finally, communities of practice, which I mentioned before, is to create small groups that do peer-to-peer type learning with one another. All right. So I'm very curious to know with, let's see, I'm going to go ahead. Yeah, I'm skipping too far ahead of myself. I'm going to go ahead and I'm going to switch the question. So what are some examples of programs or activities, strategies that you are currently implementing that in this virtual environment that would fall into the CSEP category of education, prevention education? If you could go ahead and use your chat box to share some examples of some two-way communication, because education, we're looking at two-way. How are you doing that right now with the virtual, in a virtual setting? Erin, if you don't mind sharing a few of those.
Sure. I'm seeing youth peer-to-peer support trainings.
Great.
Some people say they're not doing it. Games with online Bezzers or Kahoots. Zoom small groups, Botvins Catch My Breath, guiding good choices through Zoom. Parenting
Great.
classes
Wow.
on Zoom, movie nights and talent shows, parenting and youth classes, guiding good choices, Botvins.
All right, and so I'm going to go ahead and stop for just a second. So things like movie nights and those kinds of things, those will fall into the alternative education categories, just to make sure we're clear. So when we're talking about education, let's go back. The aim is to affect critical life and social skills. So there's that education piece typically. So not that the alternative activities can't be an important piece, but just to make sure we're talking with the education piece.
Yeah. So we're really talking about a lot of what people I'm seeing is Botvins, guiding good choices, teen outreach programs, a lot of the Zoom stuff you're doing, which sounds like educational stuff, senior wellness programs in an online meeting format. So moving some of that stuff into an online environment.
Great. Nice. Great work, everybody. And I want to go back to the one point that one person said that they aren't doing it right now. And that's perfectly acceptable answer too. So just to let you know, there are some strategies that may not be possible to do, at least at this point, virtually. So that is okay. Please don't think that what we're saying is, okay, you take everything that you did before this pandemic and move it all online, because that's not necessarily going to be possible. So I appreciate the one person who had said, and it might have been more than one person, but as Erin read out one, that they aren't doing that right now. Perfectly fine. The other thing is we have folks on here from in all different types of prevention. So it could be that your role and responsibility is in a certain area and it doesn't cover that. So that's perfectly fine too. All right, let's go on to the next one, which I went into a little bit when we talked about movie nights or dances or different things. Alternatives is the kind of catch-all for those pro-social and healthy activities that purposefully exclude alcohol, tobacco, and other drugs. So there's a no-use norm that's really established with the participation in these activities. So some examples of what we did pre-COVID-19 era are drug-free dances, youth and adult leadership activities, community drop-in centers, community service activities. So these, of course, were all done. I'd say of the ones I knew were all done in person previously. So when we think about, okay, what do we do with these? How do we move these to a virtual platform? Here are a few ideas. So we can look at virtual platforms to conduct the activities. So somebody said they did movie nights. Another person, I believe, said that they did dances, I think in our earlier question. A way, and I know, for example, my son's tennis team from school, the coach has had them meet once a week for an hour or two where he gets them together. They have discussions. He'll have like a theme of the week. There will be one week where they talk about what their favorite class is or subject. Another week where they gave each other compliments. So basically what they really appreciate about one another. So he's been trying to keep that group cohesion and that, the healthy norms and activities, pro-social. He really tries to hammer into them, which I greatly appreciate, because that just doing sports alone doesn't necessarily mean you're going to get those norms, right? So with alternatives, we have that drug-free, no use norm has to be there in order for it to be a prevention strategy. So thinking about how we can take, they can't play tennis right now, but he took that component and is really working with the kids to keep those pro-norm messages coming through, which is great. And the group bonding, which you have to have in order for the kids to really care whether or not the norms of the group are that way, right? Okay, so other ideas, virtual platforms for youth and adult leadership meetings, collaboration software to plan community service activities. So there are some things still going on. I know a lot that can't be done, but there are things I know I've seen in our community. I bet there's stuff going on in your community that people have been doing virtually, and then people go out and do things individually to actually carry out the service. And then of course, online discussion groups can be great ways to do alternatives for kids. That can be group chats, and that can be something that needs to be carefully monitored if that's going to be set up. But as somebody mentioned earlier, texting is a great way to have some of that two-way communication, which is necessary for alternatives. All right, love for you all to put in the chat box some things that you're doing right now to move alternative activities from the in-person world to the virtual world right now. So if you go ahead and put in the chat box, would love to hear what you're doing.
Game nights, forum chats, music practice, virtual youth-led summit is tomorrow. That's exciting.
Oh, wow.
Google Meets Bingo. Google Meets Bingo. Wow.
That sounds very fun.
I know. Phone calls with students and parents, virtual murder mystery party.
Oh, wow.
Yeah. Virtual after-school programming. That sounds really fun and interesting. It'll be interesting to see how that's working out.
You want your kids on that, Erin?
Yeah, please. Sorry. Virtual scavenger hunt. Oh, that's fun. Virtual exercise and walk, coalition meetings and youth council meetings, online trivia night, virtual museum tours, fun. Utilizing a clubhouse model, online wellness week, game groups online. These are great. You guys are doing lots of stuff to keep kids engaged, trying to keep them doing stuff with each other and connected. Virtual zoo trips. Great. These are all definitely fall into that kind of that category of sorry. There's a lot of noise outside my window. They definitely fall into that category of alternatives. And in some ways, alternatives can move easily into the online world, and in some ways, they can be more difficult. So if you had something already established, sometimes it's easier to move them into a virtual environment. If there was nothing established, it can be harder to make those connections.
Right. Thank you. All right, so let's move along to the next category of CSAP strategies. And we are at environmental strategies. So these are the kind of project strategies, programs that you're putting into place to impact, and they're environmental strategies. I should use the correct grammar and flow here. Environmental strategies establish or change written and unwritten community standards, codes, and attitudes regarding alcohol, tobacco, and other drugs. All right, so with examples, we're talking about alcohol, tobacco, and drug use policies in schools, maximizing enforcement of availability and distribution of alcohol, tobacco, and other drug use, modifying alcohol and tobacco advertising practices, and product pricing strategies. Now, in this current world that we are in, I'm guessing many of you, like I, have seen some of our policies and practices in our communities around alcohol in particular have changed dramatically. The loosening of laws, letting people do takeout with alcohol, with cocktails, different things that has never happened before, at least where I live. They're saying, oh yeah, go ahead, we can go ahead and do that. We have to preserve businesses, and make sure that they can stay alive, and with alcohol sales is a big part of their business. So as preventionists, this is an area we can't go to sleep on. Even though we aren't out there being able to be actively at meetings with folks, I know, for example, our county commissioners are meeting virtually, or I should say, they are in person, 6 feet apart. However, we can now participate virtually through, I don't think it's Zoom, but it's another platform. So super important for us to stay engaged in what's going on in our communities around our community standards, codes, and attitudes around alcohol, tobacco, and other drugs. So when I'll go ahead, and I know I switched into that virtual environment a little bit, but let me go more specifically. Some examples that we can use of platforms for environmental strategies include workshops, of course, like we talked about with prevention education, phone calls. Might need to do lots of phone calls right now. Make sure that we're staying on top of what's going on with our policies and laws and their enforcement. Collaboration software, again, could be used, and then participation in virtual government meetings, as I was mentioning. So very curious to hear how you all are working on environmental strategies during this time. If you go ahead and put in the chat box, what things are you doing around environmental strategies right now? How are you doing that? And it's really helpful for you all to be sharing these, because it might give other folks ideas as well, that they're like, oh yeah, I didn't think of that. That's a way I could do that.
Definitely. And someone had asked in the questions if we'll summarize this. I'm going to try to go in and summarize these and send it out. It's a little difficult, but I'm going to try to do that.
To summarize the chats? Is that, okay, yeah, because we're getting so many, that might be a little tricky, but.
Yeah, we'll try. Virtual school board meetings, phone calls, virtual prevention committee meetings, trainings, media campaigns, online YouTube, using public health law center, did sorry.
Disappear.
No,
it goes too fast.
No, there was like a noise that just, I'm so sorry. Virtual
this is
meetings.
Our reality of working in our worlds right now.
I know. Our work site is a no smoking campus. People turn off their video if they're taking a smoke break. Oh my goodness. School policy review through Zoom meetings, phone calls, trainings, communities that care coalition meetings. That's great.
Good.
Let's see, positive messaging prevention campaigns throughout the state.
Great.
Virtual alcohol policy inventory at municipal level.
Oh, wow.
Yeah, it sounds like you guys are doing some stuff.
Very good stuff.
Very good stuff. And I will definitely, so I have, it's a little tricky, but I will take this all out and try to summarize.
Great.
Summarize for you, because there's a lot of great ideas that you're sharing with each other that I think are wonderful.
All right, thank you. All right, community-based process. So some of this, I know some of you have mentioned coalition work in others of the CSAP strategies. This is really more the specific area for typically where coalition work falls. And the purpose behind community-based process is to enhance communities' ability to more effectively provide prevention and treatment services for alcohol, tobacco, and drug abuse disorders, is the definition that CSAP gives. So examples include community and volunteer training, data-driven planning. So a lot of that planning that goes on within community coalitions or within counties or even states. Multi-agency coordination and collaboration, accessing services and funding, and community team building. So this is where a lot of that coalition work tends to fall. And when we look at translating it to virtual platforms, some examples of, yet again, as I know is kind of repetitive, but training workshops using virtual platforms, such as this kind of a setting with Zoom meeting, or Skype, or GoToMeeting, or WebEx, all those. Course planning phone calls, collaboration software, which we mentioned before, could really help with the data-driven planning. Like if you're using the SPIF process, the Strategic Prevention Framework, you could set up, like if you're doing the SPIF process, you could set up in those collaboration software, and you could even use like Google Drive for this, because you could even set up folders for each of the steps of the SPIF, and the activities and strategies and tasks going on for each one, where you're at with each one. So that kind of work can be done, of course, through collaboration software. And last but not least, virtual meetings for community team building activities. So, and that's something we're going to talk about a little bit next time, is, well, more than a little bit, but is that engagement piece and how you can facilitate meetings, such as community coalition meetings, to get people engaged, keep people engaged, and make sure that that team building continues to happen. All right, so if, once again, you know the drill. Here we go. What are some examples? Community-based process. How are you doing those currently? What virtual platforms or strategies are you using?
Again, we have coalition meetings through Zoom, Facebook, forum discussions. I saw someone doing sticker shop campaigns, still Google Meets, SurveyMonkey to gather data for strategic planning. That's a great approach.
Great idea.
Yep. Clubhouse model. Community coalition meetings by Zoom, community Zoom meetings once a month. I'm sorry. For the committee, TA and consultation through email and Zoom, SPIF action planning with community groups. That's awesome. SurveyMonkey, Zoom coalition meetings. So lots of coalition meetings kind of still happening. Love to see that. And like Kris said, next week when we come back together, we'll talk a lot about how to keep them engaged and how to do some good facilitation around that. Zoom meetings for education and training, community coalition meetings by Zoom. So yeah, lots of ways that we're using the same technology in different ways to meet different ends.
Great.
Zoom department meetings, phone conferences. Great, thanks guys.
All right, so let's go into the last category of CSAP strategies. And that is problem identification and referral. So this are those strategies that work to identify individuals with misuse or abuse of substances in order to provide interventions through education and motivation strategies that can deter those individuals of continued misuse. So we aren't getting over to treatment side of assessing people to go into treatment. This is the step before that people perhaps are dabbling in that, which I know that that's not the right term, but they aren't to the point to the addiction phase where we're needing to get them into treatment. So this is kind of a lot of the terminology some folks use as early intervention. That's that point where we can hopefully stop things from progressing. So examples can be student assistance programs or driving while under the influence or driving while intoxicated education programs. So let's go to the virtual platforms. So this is when we talked about communication strategies, this is where one-on-one communication becomes very important, right? Because most of what's going to happen is going to be one-on-one. So using virtual platforms for one-on-one, phone calls, telehealth, as well as things like virtual workshops for things like the DUI education programs. All right, and last time, I'd love to hear what you're doing with the problem identification and referral strategy virtually right now. So if you go ahead and put in the chat box one last time. Hope you all are warmed up your fingers before this session.
One-to-one screenings,
Right.
virtual meetings, Prime for Life classes on Zoom. That's great. Zoom meetings. So yeah, those are the two I see. Depends on, you ask yourself, it depends on the situation. This one is so much more individualized. It can be much more sensitive. We had someone earlier mention that you really have to think about HIPAA concerns and privacy concerns when you start to get into some of this territory. Screenings arranged post-event, one-on-one if needed. That's, yeah, Zoom meetings. So this is definitely maybe a little bit more specific to the person that you're meeting with, or the situation. Referrals
Yes, it might need to have a lot of flexibility, a lot of tools for yourself to access in terms of different options to be able to reach those folks. So yeah,
definitely.
It's not most likely not going to be a one-size-fits-all for this one. All right, thank you. I'm going to go ahead and stop sharing my screen. And we have a few polls for you. So now thinking about all the different prevention CSAP strategies, and hopefully if you weren't aware what those were, you have a sense now what those are. Christine is going to go ahead and put up a poll for you. And this first poll is, what category of CSAP strategies were you implementing before the COVID-19 restrictions? And you can check all that apply. So what were you doing, back before this huge shift in our lives? So January, February, which of these categories of prevention strategies were you doing? All right, we'll give just a few more seconds for folks. All right, Christina, can you go ahead and share the results?
Oh my.
All right. Wow. So a lot of education. So that's interesting to see, but mostly there's quite a bit in each one. The lowest would be problem identification and referral. So that kind of mirrors the amount of chat responses we got in terms of continuing on. So that's interesting. Lots of community-based processes and information dissemination as well.
Mm-hmm.
All right, so kind of take a mental picture of this, and we're going to do another poll, and let's see how they differ, they contrast. So go ahead, Christina, do the next poll, I should say. So what are you doing now? So what category of CSAP strategies have you been able to continue during the COVID-19 restrictions? And again, check all that apply. All right, just a few more seconds. All right, Christina, if you could go ahead and share the results. I feel like a newscaster when I do that.
Oh my goodness, what a difference.
Look at that. So information dissemination, as we talked about when I went into that one, I said this can often be something that we were doing before is easily translatable to what we're doing now, I think is what we're seeing there, right? Education still is higher up, but
so
and then go ahead, Erin.
I actually wrote down the numbers from the first
great.
one real quick. And we saw a change from 93% in education, who said 93% of folks said they were doing education and before, and 65% now. So that's a big change because it's a really hard one to move. That's a really hard thing to do. Information dissemination actually went up. We went from 78 to 83. Basically, we're seeing kind of alternatives hang around the same amount. Environmental dropped a lot too. We said 53% before, and now we're saying 28. And then they stopped lining up really well after that. 78% of folks indicated they were doing community-based processes before, and now we're seeing 50 or 40, just 45. And then problem identification kind of isn't too much of a change, 33% before, 21% now. So everything has changed. Let's to be really clear, everything has changed. If you're doing education in schools, that's dried up, someone said. Absolutely.
Yep.
You know, interestingly too, I've talked to people in multiple states and really have heard different experiences. For some folks, schools have said, hey, keep doing this. And for others, they're like, get out. We've got to figure out the rest of this. So different experiences in different places. Yeah, you know, just because you're still doing something doesn't mean you're able to do it at the same level. So yeah, thank you for that, Karen. Absolutely. A true point. So even though these numbers may look like you're still doing things, it may be at a completely different level or with different levels of fidelity. And so let's keep moving, because I think now we're going to get into some of the let's think about what we're going to do and how we're going to do it. Those were really fascinating numbers. Thank you guys so much for doing that for us.
Yes, thank you. And great points being made on there in terms of, and I'd love to hear just a few more thoughts of, so for those of you who said you were previously implementing a strategy and now you aren't, why is that? I'd love to get a few more thoughts on.
And I want to point out one of the things that Joan said, that although I feel like I'm doing the same strategies, I don't feel like I'm getting the same engagement. I lost it. Effectiveness and integrity. And that's something that we're going to talk about with this worksheets that we're going to talk about, is trying to think about that. A lot of people are saying they concur. We have fewer kids participating in their coalitions. They're tired of staring at screens.
Yep.
It's really tough to get engagement. Yeah,
Lots of schools and businesses closed. Yep. So the reality is that we can't just pick up what we were doing in person before this and move everything over. That's not the strategy. There may be shifts in where we want to put our time and energy, where we can be more effective at this point. So I just want to make sure, and we're all exhausted. I love that. Yes, Victoria.
Yeah. And,
especially people with either home with kids and doing distance learning and your job, or folks who are teachers who have taken, trying to do everything in, quickly, like overnight, start distance learning. So yes, and for many other reasons, yes.
Yep. Environmental is hard. People are saying the community leaders are inundated with, yes, right. So it's hard to keep those community leaders and volunteers who've been so invested in your work focused, because now they've changed their focus to focusing on the issues related to COVID. Schools were resistant to prevention because kids were, oh man, I keep losing it. We're not compliant with schoolwork. They don't want to burden with more lessons, right? I know.
Yeah.
More frequent and shorter lessons.
And we're going to talk about that next time too, of some possible options to start looking at what we're doing to keep people engaged. Yep. And kids are overwhelmed.
Yeah, we're starting to see some real impact of all this on kids. School. Let's see.
Yeah.
These are great, guys.
Yeah. So we want to take this moment to acknowledge that just because there's a shift in those numbers doesn't mean you aren't working hard. You aren't doing all that you can to do this. But there are some realities we need to acknowledge about what we can and can't do, and where can we put our energy to be most effective at this point. So let's go ahead and switch gears a little bit and start showing you those worksheets that we mentioned earlier, because hopefully this will help you walk through these decisions about where to put your time and energy as we're moving forward at this point. So I'm going to share my screen, and actually let me point out that again, these worksheets, if you don't have them yet, they will be emailed to you right after or soon after our session when we pull together all the materials for you. But hopefully you did receive an email before this, so check your email to see if you did get it. But if you didn't, you will get it. So just to let you know. And I'm going to give you some examples. I'm going to walk through some examples. We will be emailing out these examples to you so you can get those along with the blank forms. All right. So first of all, there is the tech capacity worksheet. So we want to look at, or the first step in doing this, just like in the SPIF, the Strategic Prevention Framework, is to do an assessment. You need to know what you have access to, what you don't have access to. So let's take a quick look at an example. I went ahead and filled this in. How you will fill it in is, of course, completely different, depending on your situation. But the first question looks at what do you already have. So what virtual meeting platforms do you have? What collaboration software do you have? And what social media accounts do you have? Then it goes into what technology platforms do you not currently have, but you could easily get. So I wrote down Twitter, TikTok, and Snapchat, all free apps that you could easily download, right? What other technology platforms do you wish you had but can't easily acquire? So it might be WebEx. Maybe there's some bells and whistles and technology that is available within WebEx that you don't currently have for virtual training platforms. And of course, WebEx costs money, so that might be a barrier there. So what training does your organization and staff or your volunteers need to feel comfortable and competent using the technology you have? Now, you can have all this wonderful technology, but if people don't know how to use it, it's kind of like you don't even have it, right? So what kind of training do you have accessible at this point? So I wrote in my example, need training on how to schedule and host Zoom meetings. Need training on how best to use social media. That could be a big thing that a lot of us know, okay, that it exists and that's a way to connect with our audiences, but I don't know how to use it. I want you to all to know, I made my first TikTok video recently. So I have to say, I am quite proud of myself. my 14-year-old son came to me, he's like, will you do a TikTok video with me? And now if any of you have 14-year-old boys, you will say yes to anything that they want to actually engage with you besides arguing with you. So I was like, sure. So it was quite hilarious, I have to say. But I will not share it with anybody. All right. So then what training resources exist in your organization or beyond that you can access? So what training do you need in number 4? And then what training can you access? So could it be the high school student health and wellness club that you might be able to access some of their members to help you with the social media? Or somebody within your organization, maybe they already know how to use some collaborative software such as Yammer. That's another way to access training. So not necessarily, I wouldn't necessarily think, oh, we need to buy training from such and such an organization, but think about what capacity and resources you have that you can access already within your the folks that you work with, either as volunteers or staff. Erin?
Yeah, absolutely. This worksheet is a great place to start because it's such a great getting a feel of what you have at your fingertips and what you might need. Just to do the assessment, to walk around your agency. Probably not there, but to talk with people in your agency about what you have access to. You may not know about your Instagram page, or you may not know that you have an interactive, my agency uses Basecamp, which I really ignored wholeheartedly and actively ignored for a very long time until we came to this situation, and now I'm using it. So the more you may really need to spend some time doing this. It'll allow you then to know what you have access to and what you don't have access to. So that's one of the things that's helpful, I find, is to know what I don't have. I'm not going to be able to get WebEx. I'm not going to be able to get Zoom. My agency has a policy that we are not using Zoom. There are security concerns, there's HIPAA concerns, whatever the reasons. If I know what I can't have, then I know the limitations when I get to the part of saying, how can I, whatever.
Right.
So I think it's important to do this research, to find out what you have access to, what you don't have access to, what you can get, how you can get trained, so that you can then really dig into how can I, or maybe I can't, translate what I have been doing into a virtual environment. So this is the first important step of understanding what you have available to you and what you don't have available to you.
All right, and I want to make a point. Jacqueline wrote that she was curious about safety concerns with TikTok and Snapchat. I want you to know we are going to talk about youth safety concerns at the next workshop next week. So if you want to kind of hang on to that, we will not talk about specific platforms, but the process to go through to ensure youth safety. All right. Let's go ahead. So now after you complete this worksheet, then you're going to go to a second worksheet. And I'm going to switch over to this other worksheet. And I don't think it switched, did it, Erin?
No, it did not.
Okay, I'm sorry, y'all. I'm going to have to stop sharing and switch over. I was trying to do it without doing it that way.
That's okay.
A little clunky.
So the next worksheet we're going to go to is about planning. And one of the things that Kris and I talked about is that preventionists plan. We are planners. We do the SPIF process. This is what we do best. So we wanted to create something that would help you plan and do an assessment process that was kind of quick but thoughtful. So
Yes.
Kris?
All right, so what you're going to do after you've done that first technology organizational assessment is you're going to look at all of the strategies that you were implementing that you're still wanting to consider moving into a virtual setting. And you're going to take those one by one. So you're going to fill out this worksheet for each of your prevention strategies. And I'm going to go ahead and walk through an example, which is a Sport Prevention Plus Wellness Program. It was one I was trying to find which one would be ideal. I was like, well, which one would most people use? I'm like, well, let's use a little bit different one because it's pretty straightforward. So let me read you a quick description that beside what's on the screen so that you get an understanding of what this program is. And it was shown to be effective through 8 different programs. So things like NREP when it did exist, Office of Juvenile Justice and Delinquency Prevention. So all these major folks. So just to let you know that. So it says SPORT involves a short, self-administered health behavior screen survey measuring physical activity and sports behaviors and norms, healthy nutrition, sleep, and alcohol use. Participants then receive a 10 to 12 minute personally tailored consultation from a written script along with a key facts handout. A simple fitness goal plan is completed by participants to motivate positive behavior and image change. In addition, parents or caregivers, caregiver communication cards addressing key content are provided during the consultation and then sent or mailed home to adolescents for 3 to 5 consecutive weeks. So that's a summary of the different components of the program. So who are the participants? They are high school students ages 15 to 18 and their parents. So next, you're going to fill out this table, which is really the key piece here. You're going to take in this left-hand side, you're going to write down each component of that strategy because we often know like parenting education program often has several different components. It could have a small group mentoring. There might be a mentoring one-on-one program, a small group discussions, information dissemination in terms of fact sheets that are given to them, as well as a larger group education piece. So think about the different components of your prevention strategy, put them in the left-hand column. Next, you're going to identify, going back to those first several slides that we talked about during the webinar, is the communication one-way, two-way, cross-team collaboration, or one-on-one. What kind of platform could be used? So again, thinking back to, for that type of communication, what kind of platforms are available that you have in your organization, remember, because you've already done the organizational assessment form, or that you can easily access, right? What changes you would need to make with delivering this virtually? So on this first line, I'm looking at a short self-administered health behavior screen survey was the first thing to happen, right, for participants. One-way communication, a Google form could be used. You would need to create an online form would be the change made with that, right? Next, you're going to look at benefits. So how could this be beneficial to move it virtually? Some things we're finding actually can be helpful. With this, students might feel more comfortable completing an online survey. That's kind of their thing. We're talking about 15 to 18-year-olds They're used to doing things online versus on paper. Any concerns about delivering this component virtually? Getting them to do it? If you have them sitting there in front of you and you say, complete this form, that could be a little easier than like sending emails, which I know my 17-year-old does not reply to emails anymore. So email may not work. You might have to text them a link with the Google form. So that could be a little bit more challenging, right? And then impact on the strategy. In my mind, there would be no impact if it's completed, right? Because that's the key thing, is you have to have that survey completed. So you're going to take each component and walk through these steps. All right, and you'll see I did that for this program. Once you've done that, you're going to reflect on the table above and really look at, will you be able to maintain the fidelity of the strategy? And what's really important here is if you are going to substantially modify this at all, then you will need to contact your funder, make sure it's okay. And also, when possible, contact the strategy developer to check in with them. Now, if they have done research on this, their standard response is going to be, if you change any way that you do it, you're going to lose fidelity. That is true, right? Because the research has not been done to show that by implementing it this way, do you get these outcomes? So if you can hopefully have a conversation with them saying, okay, we can't do this in person. Would this, your best, I hate to use guess, but your estimate, does this look likely that we could achieve we could accomplish similar things by doing this virtually? So that's a conversation that will have to happen. Erin, did you want to say something about that?
Yes, I think this is where you need to have conversations with your like she said, conversations with your funder and with the developer. I know that there are lots of developers right now who are doing adaptations to their curriculums. I know Second Step, which is a big social emotional program, has been releasing new modules, new adaptations to push out so folks can do things online. So right now, developers are really primed for conversations with you if you're doing, and I haven't had conversations with BotVins yet, but I know that people are having those conversations and they are open to talking to you. So, reach out, have the conversation. It really can only help. If they say no, you can still think about, what's my best access? Is it worse to cut this off right now, or can I get something, and how much? If you go up and look at that table and everything looks like, ugh, this is going to be a train wreck, then your answer might be, I can't do this with enough fidelity. If it looks like only some components are going to fall apart and some of them are going to be okay, then you can make a different call, right? So this is where you just have to do some critical thinking, and no one's going to be able to give you an answer. No one's going to be able to say to you, yes, this is going to work, or no, you absolutely cannot do this. There's going to just have to be some play on your end. So BotVins says is allowing virtuals and live streaming classrooms. Someone says, I can't read the rest of the comment, but will not allow their content to be recorded. So that's, a big piece that makes a lot of sense. They don't want their content recorded. And often you can't record when you have kids on a Zoom or something, but you can't pre-record it and send it out, which means you couldn't do it like by a Facebook Live, because that's going to be recorded.
Or YouTube or something like that.
Or YouTube, something like that.
Yeah.
So you have to check in with them about that. So if that's the best way to reach your kids, then BotVins might be out. So you're going to just need to dig into some of that stuff and answer those questions. And so that's why we wanted to create this kind of decision-making tool for you, because there aren't going to be clear access. So like if you were doing this for BotVins and you had to answer the questions, do I currently have a needed virtual platform? The answer might be no, if you don't have something that could reach your kids that doesn't involve recording, for example. So anyway, I just wanted to point out that there's not a clean answer.
Right. Which we would love to have, especially I know Erin and I have been working in the evidence-based driven, data-driven prevention for years and years and years and years, right? And so that's not easy for us to say, but there's just different realities at this time, right? So, you know, like Erin said, do we want to stop doing things altogether, or do we want to make our best judgments based on the information we have?
Mm-hmm.
All right, so let me go. I know we're quickly running out of time, so I want to make sure I get through the rest of this form. So after you ask, or you're talking about maintaining fidelity, if you think you can continue, then you want to say, do we currently have access to the needed virtual platforms? So up above in the table, you will have listed what kind of virtual platforms you need. And if not, and if partially, what do you need? And if no, how do you leverage the technology? Is that possible? Do you currently have the technology skills and support to implement your best virtual setting choice? Yes, no, or partially. And then a key question, although it's towards the bottom, but it's a really important one, is how many of your participants have access to the technology? It could be that this is going to work great, but if your participants don't have access to the technology or to the internet or to the devices needed, all of those pieces, then it's not going to be helpful, right? And next week, we're going to talk about access to disparities. So just let you know that that's an important piece that we acknowledge at this point. So the last question is, reflecting on all of your answers above, how likely is it that you can move this strategy to a virtual setting? So that's okay, step back, look at all this information. Is this something we want to try to move forward with in a virtual setting? Or perhaps it might be something, hey, we need to put a pause on this because we went and we did this worksheet for all these other strategies, and it looks like these are going to be much more likely to be effective virtually than this one. Might put a pause on it. If you, again, have a discussion with your funders, don't just stop doing things. Well, but Kris said I could just stop. No, don't do that. I don't want you to jeopardize your funding at all. But you would be, have this information to back up what the decisions you're wanting to make. Is if you've been able to walk through all this and say, these are the reasons why we're thinking we need to put a pause on this. Or these are the reasons why we think this will be effective to continue in this way.
Mm-hmm.
All right, so real quickly, because we're time is quickly running out, I wanted to check with Erin if you see any burning questions that you think we need to answer.
Yeah, I want to get through a couple of questions that have come up in the chat, and one was from Karen Jarzik, who says, I hear many people saying the names of evidence-based curriculums, wondering if the curriculum developers are allowing people to use their materials virtually or to create materials for e-learning. Too Good for Drugs is not allowing any use of their materials. Do other curriculums allow that? So I'm gonna let people answer about their specific curriculums if they want to in the chat. If anyone knows specifically, we heard a little bit from Botvins. I know I said a little bit about Second Step. If people have any specific experiences, you can answer that in the chat. Generally, I would say you do have to ask permission to use them and to have them recorded. You have to find out what the requirements are. But you may be stuck. So we hear some people saying that they're not allowed to at all, and other folks saying that there's limitations. Like I said, I do know that some of the developers are coming out with adaptations of their curriculums to make them work better. So I know that it's not really a great answer, but it's more of an answer to the crowd. So I'm going to let the hive mind answer that question. So I'm going to just let that kind of roll and let you guys look through the chat while I go on to the next question. So regarding conversations with the funder or developer, is there a value in continuing even if it doesn't meet all the criteria? So we are maintaining the relationships with the schools and the students. This is like, sounds like maybe. And I think sounds like maybe, Karen, I think is probably correct. If you think that's a valuable way to maintain relationships with the school and to support the school, I think that's great. I think there's lots of value in continuing programs. I think we talk a lot in prevention about little wins. And relationship maintaining right now, sometimes that's all we can do. So that was one that had been brought up a couple of times. So those were the ones that were kind of had been liked a few times. So let's I think, yep. Someone did bring up the issue of social media and the legal age for using social media. So 13-year-olds, I think, is the Facebook age. So just kind of a reminder, thinking about that, communication campaigns that are targeted for kids under that age, or if you're asking children under that age to engage with something that's on social media, you may want to rethink that, or think about different ways to reach that audience. I think that's a great point. I thought I had another one, but I feel like it disappeared. So, okay. Someone did ask others for advice on how they're making movie night happen. So again, if you're making movie nights happen, I'd love to see you respond in the chat to how you're making movie nights happen. Okay.
All right, well, thank you. And just one reminder to close things up, and then Erin's going to give a few key details for ending the session and what's coming up. But give yourself some grace. All right, we won't be able to replicate everything we were doing before. As somebody mentioned before, many of us are exhausted. We got to we got to keep ourselves healthy, right? If we exhaust ourselves, run ourselves out, there's not going to be folks out there doing prevention. So we got to keep ourselves healthy, give yourself grace, and select what you can, where you want to put your time and energy in to make it successful. Don't feel like you have to do everything all at once. Start, as Erin talked about, also those small wins can be very important. That can we do this and do it well? Can we do it now, do this and do it well? So don't feel like you have to do everything all at once. All right. Would love for you to put in the chat box how you thought today went, how it worked for you. Any suggestions for next week of something we can do different that would be helpful for you in your learning. And I'm going to go ahead and turn it over to Erin to wrap things up.
Great, thank you so much. Thanks everyone for being with us today and taking the time to review this. We hope that these worksheets and the resource guide will be helpful to you. If you didn't receive it, you will receive it afterwards. What you will receive will be all the worksheets that we talked about, the CSAP guide and the CSAP 6 strategies guide, and the resource guide, the Prevention Practitioner's Guide to Virtual Settings, I think. So all of those hopefully will be useful to you as you think about planning for and taking your prevention programs online, which some of you already have, and maybe taking a step back and thinking about how to do that in the best way. It feels like we're going to be in this situation for a little while, so really taking a beat to think about that. We will have a second webinar next week. Christina has posted, I believe, the registration link in the webinar, in the chat. We'll also send that out again. So if you haven't registered for next week, she's going to post that right there. It is. Please register. We're going to be talking about how to facilitate and engage with your participants in the virtual setting, how to bring them into the virtual setting, and then how to engage with them. We will talk a little bit about the challenges related to technology and those who don't have access to technology during this time. So please join us next week as we do that. And if you get a chance to use those worksheets and look at those resource guides, when you come back next week, we'd love to hear how that went.
Yes, great. Thank you, everyone. Have a wonderful week, and we will see you soon.
Thanks so much, everyone.
Bye-bye.